So one of the quirks of a Medicare health plan, that is things like a Medicare Advantage or a Medicare Supplement, is that they are run by private health insurance companies who pretty consistently want to add extra benefits to their plans, and they do, but basically nobody ever uses them, even if they are some of the most amazing, pretty awesome, pretty good benefits. So let's talk about the 5 extra benefits that someone on Medicare can get, but basically nobody ever uses. Now this is Michael's Medicare, where we talk about all things Medicare, from Medicare plans to Medicare benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it helps our channel to grow, and that is always very nice, but also because it'll keep you up to date about the newest Medicare changes, the newest Medicare options, and ways to make more, better informed Medicare decisions. All right, here we go. So let's talk about first, what are extra benefits and why they are, and how does somebody get these extra benefits when they have Medicare? Well, extra benefits are additional benefits that you can get by enrolling into any number of Medicare health plans, or Medicare supplement plans, or Medicare Advantage plans. These are benefits that are not actually covered by original Medicare, but are available through Medicare Supplement, Medicare Advantage plans that are accessible to somebody who has both Medicare Part A and Medicare Part B. Technically, these extra benefits should not be used as a way to entice somebody to enroll into one plan or another, and they definitely are not, but some of the benefits, which we will talk about today, are very enticing and probably do have some effect on some folks' decision. But of course, who am I to say, right? Additionally, some of the most popular benefits that people find themselves oohing and awing over, these must-have benefits, well, they never actually get used. And I guess one last thing before we get to the extra benefits is that it's important to keep in mind that the 3 most important aspects of a Medicare plan or Medicare decision is the doctors, is the prices, whether you can afford it or not, and is the medications. Everything else, including these extra benefits, are a far distant secondary consideration. First up, and really the most wanted and pretty much the least used benefit I see with my Medicare clients is for the free gym memberships. Now these benefits are actually really good, and like any other gym membership, either through Medicare or not, or whether it's free or not for that matter, nobody really uses it. Only a small percentage of people actually use these benefits. Usually this benefit is run through a third-party organization that makes going to the gym pretty easy. All somebody has to do is choose a Medicare health plan that has this extra benefit, register, and then they can go to most, if not all, of the big gyms and even some of those small mom and pop ones that people really love. All they have to do is show them the little tag after they register, and they're in. The theory in this one is really a win-win situation, because seniors who exercise, who are healthier and who are happier and have a better quality of life also are considerably less expensive in dollars and cents for the Medicare plans. The only flaw to this, of course, is that, well, nobody really goes. But boy, does the idea of having a free gym membership feel just warm and cozy. And that's why everyone loves it. But let's face it, folks, we got to get going to the gym. Next up is really a popular benefit that some of our clients actually do use, but not enough. And all of our clients actually love it, but it just doesn't get enough usage, I guess, which is the over-the-counter benefit. So we know that original Medicare doesn't cover any prescription medications at all, with a few exceptions. And that is why somebody may choose a Medicare Part D, or a prescription drug plan, or Medicare Advantage plan that has a Part D attached, or an MAPD. Each of these has their benefits and their scenarios, but often when somebody has a Medicare Advantage plans, there will be an inclusion of a quarterly or maybe even a monthly budget that a beneficiary can use for anything that is in the catalog or sometimes in the store that are considered over the counter. So how does this work is usually every quarter or every month, a plan will set aside some money, maybe $50 or $100 or $200, or even, I think I've seen as high as $300 per quarter that someone can use for their over-the-counter goods. These dollars can be used for things that normally are at the pharmacy but don't require a prescription, and they're not really medication. So think, bandages and cough medicine, or my personal favorite is a toothpaste, because if all else fails, there's nothing like $300 worth of toothpaste, because it really makes a great stocking stuffer. Every quarter, a client or a person who's on these plans or a beneficiary can put an order in through the catalog or even have it shipped directly to their house or even to the store and pick it up at those ones that participate. The catch to all this is that the money usually cannot be rolled over, and it has to be used for things that are on the catalog, and that there may be a specific limit or time limit to the items that someone can get. But overall, it's a great benefit, and some of our clients usually come in to get help setting it up because it can be a little complicated to fill out the forms and get everything submitted. But basically, it is offsetting, their budgets in real cash for those things that they would normally buy, but now they don't have to spend their own money on because over-the-counter benefit. So pretty good. If you have it, make sure you use it. So next up is for those folks who have a lovable fluff ball running around, which is pet services. Now sure, if you or a loved one are in the hospital or is having a medical emergency, the first thing you're thinking about may not be where is Mr. Fluffy going to be spending the night, but it is a pretty serious issue. So some Medicare health plans will include pet services as an extra benefit that would pay for a number of days in a boarding house or even a certain number of walks per year. There usually are going to be limits to this, but it could be a big, big help in a pinch. And I wonder if you could use it to get a break from your neighbor's dog. Just kidding. He does bark a lot, though. Now, for a lot of folks that have chosen to age in place, which is becoming super common across the United States, especially here in California, you gotta love that Prop 13, right? It also means that having a house can require a lot of effort to keep in ship shape, including to keep it pest-free. And if someone isn't as mobile, maybe as they used to be, or is not really able to get into those nooks and crannies or setting out traps or things like that, it can be a big task to try to keep your house pest-free. That is why some plans will include pest control, because needless to say, having pests around isn't really the greatest for anyone's health, even less so if somebody is physically vulnerable. So some plans will include at least an annual covered pest control service to come in and inspect the house and try to control for specific pests that often can be the most dangerous to the house and also to the person. Again, I think it is another amazing benefit that could do a world of good, even just as a maintenance every year. Although I am curious about what kind of covered pests they are, because I know in places like Florida, they got pretty crazy iguana problems. So I wonder if those are covered. I'll have to look that one up. And lastly, and kind of quickly, sometimes if somebody has coverage through a Medicare supplement or even a Medicare Advantage plan, certain ones will cover medications that are not covered under Medicare, that are not covered under PDP, and are not covered under the OTC catalog, but can be added. So things like, the little blue pill or Viagra or other medications that don't fall into the formulas, vitamins and things like that. So that is another great benefit that often gets offered, pretty straightforward, and a world of help for folks who want to use it. All right, so those are going to be the 5 different extra benefits that someone gets through Medicare. So that is the gym membership, that is the pet services, as well as the pest control and the over-the-counter and the extra off-label medications. And the difficult things about these is they can be sort of a pain to set up. You got to fill out the forms, you have to submit the registration, you have to mail things in, all those kinds of things. But ultimately, that should be something that your agent is willing and able to help you do. And if they're not, you can definitely find one who definitely is. So that's going to be it for today's Michael's Medicare. And if you have any additional questions about extra benefits or really anything Medicare related, or just want to get a bit more information about your specific situation, please feel free to reach out to us at the information down below in the comments, or give us a call, or check out our other great videos on the socials on YouTube and Instagram. So for Michael's Medicare, I am Michael, hoping that you have a great rest of your day, and goodbye.